Let us begin the talk today with lighting a lamp. I call upon President Dr. Siddhanand Pujari, Secretary Dr. Prakash Harishchandra, Treasurer Dr. Juliana Saldana, and CANARA Orthopedics Association representative Dr. Vikram G. K. Bhatt, and Dr. Sandeep Rai and Dr. Rajesh Ballad.
May everybody be happy, may everybody be healthy, may everybody be free from pain, may everybody be free from sorrow, may we be the healing cure beyond every greed and lure. Thank you.
Thank you, sir. Now, I request our President to welcome the gathering.
Everyone, on behalf of Indian Medical Association Mangalore branch and the CANARA Orthopedic Society, it is my pleasure to warmly welcome you all to this special IMA Endowment lecture held in memory of late Dr. M. SUDHAKAR Shetty, respected Professor of Orthopedics and one of the pioneers in Department of Orthopedics. And today's gathering is not only an academic event but also a moment to remember and honor a great personality who contributed so much to this medical field. I extend warm welcome to all the members of IMA Mangaluru. And also I extend my heartfelt welcome to our esteemed chief guest, Dr. Sandeep Rai, who is a renowned pediatric surgeon, simple person, and Dean of the IMA Mangaluru. And he told, don't tell anything more than this. So a warm welcome to you, sir, this IMA program. I also hereby welcome distinguished orator Dr. Rajesh Ballad, Professor of Surgery, IMA Mangalore. We are grateful to you for being here to share your valuable insight with us. And I would like to acknowledge the presence of Honorary Secretary Dr. Prakash Harishchandra and Treasurer Dr. Juliana Saldana. And on behalf of CANARA Orthopedics Society, the President is in Bombay. So Dr. Vikram G. K. Bhatt is representing the President of CANARA Orthopedics. Welcome, sir. This lecture is a meaningful way to remember late Dr. SUDHAKAR Shetty's legacy and to continue the spirit of learning and sharing the knowledge. And also welcome Dr. Rohan Shetty is here, Dr. K.R. Kamath. So once again, genial welcome to each one of you to this program. I wish you enriching evening ahead. Thank you.
To brief about Dr. late SUDHAKAR Shetty.
It's my proud honor to every year read and tell something about our teacher, Dr. M. That is Munkur SUDHAKAR Shetty, sir. I expected our department PGs to be here. I have told at least 2-3 times, please do come. But they will be joining, I hope. Sir was born in illustrious Burnt family on 4th December 1946. He did his MBBS from BMC and also MS from one of the important colleges of Bombay University then, and worked as a resident in GS Medical College. And then he joined KMC from 1975 till he got retired from KMC, working for 32 years. And he was the professor and head of the department when then he went to IMA Medical College, and there he led as a vice dean. And that is my batch. I was with sir, that is in 1997 I passed out after my diploma. Sir has joined IMA Medical College, and he became vice dean of that college. And SUDHAKAR Shetty sir was training more than 200 postgraduates whom he has guided immensely and who remember him even today for his guidance and his impressions in their mind. He had an inherent thirst for teaching and started this course, that is Mangaluru Orthopedic course, which was his vision and brainchild. And this is famous, and more than 41 courses have been conducted, and now it is in his name, runs as SUDHAKAR SHETTY Memorial Mangaluru Orthopedic course. That is the way sir was, always surrounded by PGs, and there are so many, and most of them have now become professors and head of the institutions and all the things. And I can see my department, a few of the staff members also there. And these are the students who proudly tell that sir has guided them, and they always, most of them have given his oration in this very hall. And he is the one who started the CANARA Orthopedic Society with Dr. Usman sir and Shantaram Shetty sir, and which is running even now as one of the good associations who are conducting a lot of teaching program in this part of the state as well as South India, and was the ex-president of KOA and also OSS, and he was an active member of all the orthopedic associations in the country, and he was awarded the coveted honorary membership and lifetime achievement award by Indian Orthopedic Association. And he was a keen badminton player. His day will start as early as 5 o'clock, and that is one of the things. Early morning he'll go for playing badminton, and he was also known for his compassion for his patients. Madam Amritkala Madam was telling after his sad demise how many patients came home and were expressing themselves that how he has treated them compassionately. And Dr. M. SUDHAKAR Shetty has a lot of contribution to this particular IMA, and this hall is also one of the main thing that is today we are here because of his commitment along with Dr. Jerome Pinto and all the trustees, Dr. Devadiga and all. So he is the one who went around and saw that this hall will be done in this way, and he has been led as secretary, president and trustee of this IMA trust, and he was secretary till that last year of his life, and he was there in all the meetings of IMA. In the first row he will be here, and always most of orthopedics surgeons I see, they are not seen, but sir would have been there for all the meetings without a failure, and that is one of the things I also feel I got a little bit encouraged, and that's the reason I'm here. And sir was given Karnataka government has given the Rajyotsava award, and he's the one who conducted the first OSS con in 2007. Till that time South Indian state level conferences were not held, and these are his friends and colleagues who were there on the dais that day, and that was Chako sir and a lot of South Indians orthopedic surgeons around, and all of them were there for that particular course, and that was the first orthopedic course. And we and in fact this endowment lecture in his name was started under the leadership of Dr. Rajesh Ballal as well as Manjunath Shenai was the president that time. So he told, in the CANARA Orthopedic Society we have a oration, so we should have one talk because of his contributions for the IMA. Hence it was, and first course was that one was given, the talk was given by, oration was given by Dr. Shantaram Shetty sir, and next year it was Bhaskaranand, and like on today his student Dr. Rajesh Ballal, our friend, is going to give that lecture. And in all, he was a exemplary leader, teacher, mentor, role model, disciplinarian, and a lion-hearted, superb host. Mangaluru was always remembered in orthopedic fraternity for his superb host, and we are very happy that we were his students, and he has left an impression on all our mind. Thank you very much for the opportunity.
To felicitate Dr. Sandeep Rai.
Dear President, Dr. Sadanand Pujari, our very dynamic team of Prakash, Ullas, Dr. Julian, and my very dear friend Dr. Rajesh Ballal, who's going to deliver the address. It's an honor actually when you asked me to come and be the chief guest of a function where I was a big ardent follower of Dr. Sudhakar Shetty. I don't know how many of you all had the chance of actually interacting with him, because my first interaction was in 1992. I distinctly remember. He's a huge person. I mean, big guy with white coat, which you saw on the photograph, which he used to always wear with the tie and walk. When he walked, he would take half the corridor. The other half would be followed by postgraduates behind him, and that would be a long length of them who would be following him. So there was a patient who was lying in the surgery ward, and he happened to come there. It was an exam which was over. The day after the postgraduate exam, he walked into that place. It was presented as a fixed hip, and this postgraduates had passed after presenting as a fixed hip, and Dr. Sudhakar Shetty wasn't the examiner. He just walked up till there and then examined the patient, undid the fixed hip, refixed it, and said, let the joker operate it. This is how he was. Everybody thought it was a fixed hip. Everybody has passed the exam as a fixed hip. The examiners have passed him as a fixed hip. And Dr. Sudhakar Shetty undid the fixed hip and refixed it. On that day, I was looking at him and I was standing by the side. He looked at me and said, "What are you looking at?" I said, "Sir, I have no clue what you have done. I am a surgery PG. Please let me be." This is how Dr. Sudhakar Shetty was. I mean, he could be somebody who could be very magnanimous at one time and also be very tough on the other hand. And he could joke, and I could also be strict in the same sentence. I've known Dr. Sudhakar Shetty take us apart when we were surgery postgraduates posted in orthopedics as well. He would say that, "You show me how you are doing the dressing," and then he would make us feel like, "You are no surgery PG, you have no clue, I will teach you how to do it." Dr. Sudhakar Shetty was an inspiration, and for me this is a great opportunity to, I had wished that, when Dr. K.R. Kamath said that the postgraduates, this legacy of honoring somebody is for us to learn from their life. If the postgraduates do not think it is good enough to be here, they shouldn't be here. So Dr. K.R. Kamath, don't worry about it. We will continue these legacies, we will have it. It is our memory, it is good for us. If they do not want it, they are missing. We are not missing anything. Thank you for a patient hearing, and thanks for having me here.
It's customary to introduce today's orator. And this very oration started during his tenure as a president. Thank you very much, sir. Sir did his MBBS, MS from Kasturba Medical College, Mangalore, and DNB in 1993. And he worked initially in Kasturba Medical College and then moved on to Kshema, where he worked as a professor and HOD later. And then he was examiner for so many universities and conducted CMEs and guided so many PGs. And the most important thing, I think I told you already, he started the oration. And he is a chief guest and resource person of so many things. But what I know is, I know him from 12 years. Nera Ditta Nirantara. He speaks on the face, because I know, because I was the secretary of AMC that time, he straight away sent a warning letter. I think that's how we started our interaction. Thank you very much, sir. I welcome Dr. Rajesh Ballal to deliver the oration.
I must confess, I was a little embarrassed when they put the PETA, etc., and the chief guest got back at me in a form called KISS. It says, "Keep it simple, stupid." Thank you for not embarrassing me further. I must start this formally. There's this very famous Sanskrit saying, "Guru Brahma, Guru Vishnu, Gurudeva Maheshwaraha, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. As I bow my head in reverence to this respected teacher of mine, I am grateful to the office bearers of the IMA, the CANARA Orthopedic Association, who thought it fit that I should deliver this oration. I am especially thankful to Dr. K.R. Kamath, who spoke to me about a month ago and said, could you speak? I jumped with joy, but then acted a little coy and said, give me some time to think about it. Chief guest of today's function, Honorable Dean of my college, Dr. Sandeep Rai, senior members of the IMA, my teachers, Dr. Jerome sir is here, Dr. Venkatrappa is here, my classmate, Dr. Gilbert is here, the very Honorable Rohan Shetty is here, who's much closer to sir than all of us put together, members of the IMA, my dear friends. I was a little perplexed initially when they said, sorry, could you speak? Because I was wondering, where do I fit in this scheme of things? Because if you look back at the history of this oration, mostly it was given by orthopedic surgeons. So I, as a non-orthopedic surgeon, was wondering, how do I fit in? And then the next fear was, how do I choose a topic? Not only I was worried about what the audience will think, I was also worried about what sir would think if he would be around. Just knowing him, because if you looked on stage, I was the odd man out. I was the only fellow with a tie. There was no way I could come and give an oration about Professor SUDHAKAR Shetty without a tie. If he was around, and Sonali is nodding her head, if he was around, he would have torn me apart. Right? So he's wondering what topic to choose, and something that's bothering is, I wanted to speak about ethics in medical practice. I don't know if sir would have approved it or not. I hope he's happy wherever he is. But if he had approved, I'm fairly certain, in his characteristic drawl of Tulu, he would have said, "Avali Javane." Never thought this was possible. I've heard him saying multiple times to multiple people when he was not the butt of the jokes. Please pardon, some of these slides will get repeated because Dr. Kamath didn't tell me that he's introducing it formally. So some of these slides, there will be an overlap before we go on to the talk per se. This is a treasured photograph. I must also thank Mrs. Rohan. When I called her and said, can I get a few family photographs? She sort of agreed and let me share some of these priceless, I should say, photographs. That's the happy couple in more happier times. Rohan will tell us when it was. This is a photograph of sir with two of his jewels. Forever probably the family man. A photograph of sir with, in front of the Taj Mahal. That was, somebody said he was always on time for the IMA meetings. True, I know, because after that he used to go and operate in places like Mangala. And surgery used to go until 2 in the morning. Probably the only time he was not operating. That is a photograph. This is a very treasured photograph for us, because when we started the IMA, Kamath said that I started. That's not true at all. I just collected the money. I'm very grateful for, I still remember, we had an aim of 5 lakhs when we wanted to start the association, the oration. And I said, please give me 5,000 rupees each. To my absolutely pleasant surprise, we exceeded that amount. That was the reverence sir had in this hall, in Mangalore in general, because people volunteered to give. We collected more than we anticipated. Somebody else spoke about, of course, this is a repeat photograph. This is him being honored by the IMA. There's a very young cherubic K.R. Kamath there. Is now looks a little more wiser these days. 2 things about sir, never forget. One is, the chief guest also mentioned about his dress sense. You could never see him shabbily dressed. There was no way you could see sir without a matching shirt and a pant. There were always two fashionable pens in his left front pocket. He had a beautiful sense of humor as long as you were not the butt of his jokes. If you were the butt of the jokes, it took a little time to realize that somewhere it's hurting. Right? But if somebody else was the butt of the joke, it was worthwhile listening to him. All this has been told, like they said, very big orthopedicians people have become. That is an anomaly today because that's an all-male orthopedic department. You find the number of women taking up orthopedics today has increased, and probably sir would have been much happier if he had seen the number of women taking up orthopedics. All in all, we miss you, sir. They said he rose to become the Vice Dean of Yanapaya. True. If fate had not taken him away, probably he would have progressed much, much more in the field of orthopedics as well as in the field of academics, but then I suppose that is life. Give me the next 20 to 25 minutes to speak about this ethics. We sort of got it on ourselves because from time immemorial, whenever you speak of medicine, they call this a noble profession. They said, medicine, physicians or doctors, whatever, must be above the rut, so to say. And we sort of encouraged it and said, okay, it looks nice, become a doctor, etc., etc. But then that has its own pitfalls. There's an even famous Sanskrit saying, and that is Vaidyo Narayano Harihi. And if you look at doctors, many places, this is exemplified, sort of exaggerated. Said, oh no, Vaidyo Narayano Hari is true. What is conveniently forgotten is the entire Sanskrit sloka is this. And that says, Sharire Jarchari Bhute Vyadigraste Kalevare Aushadam Janavi Toyam Vaidyo Narayano Harihi. 3/4 of this shloka is nobody knows. And only the last part is always said that the God is equal to, the doctor is equal to God. For those of us who are not familiar with Sanskrit, that's the English version, which says, only when the body is racked by diseases, then medicine is like Ganga water, and at that stage, a doctor is like God. But what do? You conveniently forget everything else, and then equate the doctor to God. So you can't, there are many things that you cannot do or should not do. Right or wrong, I leave it to you. I am not saying I am the expert in this, I am giving you magic solutions, etc., etc. This may be a sort of an outpouring of the angst, so to say, as to where we are going and what I probably think of it. Because if you Google and say put top doctors of the country, one photograph that comes up is this. This is a gentleman called Dr. S.S. Badrinath, who's founded the very famous Shankar Netralaya. And you look at the write-up, it's even more interesting. It says, even though he had the opportunity to go to the United States, there was some inner calling, blah, 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 some spiritual guru, etc., etc. And then he founded the Shankar Netralaya. And what's sort of said about the Netralaya, whatever number, almost 40% of surgeries are free of cost. So it's a given that if you are a good doctor, this is what you must be doing. Contrast it. You just put top lawyers of this country and this gentleman's photograph comes up. This is the very famous Harish Salve. And you put up about Harish Salve, you put what is it, this is what you get. He charges, forget the zeros, 10 to 25 whatever lakhs per appearance. If the case gets adjourned, doesn't matter, you still pay Harish Salve. He charges his retainer, for corporate cases, 1 crore is his retainer. And in small letters it is written, when he represented the country for that famous Kulbhushan Jadhav case, he charged ₹1. There are a whole lot of doctors who not charging ₹1 also, nothing gets gets highlighted at all, because it's been ingrained that white is pure. Nobody talks about what black is, right? So there is this inherent flaw, so to say. So I ask you a very simple question, a very difficult question, so to say, is it wrong to make money? This is what, wherever you go, whatever you do, say, no, doctors must make money, but not really this one. And that continues in life also, because if you look at how medical education is, I'll give you some facts and figures. These are not mine. These are what is available on the net itself. The health minister spoke about a historic surge in the increase in number of medical seats, 1.4 lakhs, etc., etc. And he spoke of, 1.3, 78,000 medical PG seats, etc., etc. Government and private. What about the government? What are the total number of government seats in this country? 330 plus medical colleges, 52,000 seats in medicine out of whatever. That's not worrying. What's worrying is this: 24 lakh students appear for NEET every year. One of the biggest lies, I suppose all of us will relate to this, is in 10th standard. Your parents, your well-wishers say, you study for the next 2 years and then life is made. Life is still not made. So it is difficult, yes. So 24 lakhs students appear. Obviously only the top ranks will get in, right? And there is regional disparity. So if you just put a back of the hand math calculation, divide 24 lakhs and 52,000, the ratio, I'm not excellent in maths, but the ratio is about 2%. That is 1 out of 48 of us who appear for NEET manage to get into a government college for MBBS. The rest of us, we keep struggling. We look at the fee structure. In the government, 5 to 50,000 per year. In the private, 7 to 25 lakhs per year, multiplied by 5 is 1.25 at the highest level. Deemed universities, anywhere between 15 and 40. Multiply that by 5, you get a fairly astronomical sum. That's not all. It says, according to in the last year, 2,800 plus medical MBBS seats remained vacant, often in private medical colleges. One of the things was the fees. So you can't get into a government medical college because you don't have the marks. You can't get into a private medical colleges because sometimes it's a little too expensive. That is part 1 of the story. Part 2 is after that, can you do something? Yes, you do PG. Where are the fees? Government colleges, yes, the fees are low. Again, competition is high. Private colleges, 10 to 15 if you get the merit or what is called the state quota. It keeps going up. At the NRI quota, the most expensive seats, 30 to 50 lakhs per year. So if you look at the higher end, 15 to 3 is 1.5 crores. 25 into 5, the most expensive seats there, 40 into 5 is, nice background, 40 crores. So you spend about, it's a little more than that, yeah. My maths is not very great, yes. Sonali is, etc., right? So you spend that much of money, and then they expect you not to make money, because I'll tell you as we go on what happens in life. So you just put this sort of it's not the life cycle of a plasmodium or something. You look at the life cycle of a medical student, 5.5 years for your undergraduation. This Gen Z is very famous talking about a gap year. They just take a gap year. I don't want to feel like doing anything. 3 years of post-graduation, and then yet another gap year, and then you do super specialty for 3 years, and then you do your fellowship. I have not completed that because it doesn't happen. It doesn't this one like that. All in all, you're probably spending about 15 years. Basic minimum. Not all of us can get in immediately after MBBS, straight away into MD, etc. So the situation is rather bleak. I put this as a sort of a parody. If you look at the evolution Homo sapiens is supposed to be the most evolved. And I had a teacher who said, Homo sapiens, if you look at the young ones, along the evolution scale, the young one is most dependent on its parents as you evolve more. So he said Homo sapiens, in the Homo sapiens, are most evolved because children are most dependent. By that scale, medical students must be most evolved because you are dependent on your parents for more than half your life. Not a very pleasant scenario at all. So what are my options after that? Either I join a medical college. There's this 2023 article which came in the Hindu. They said less than 100,000 medical teachers in this country. You know, we can almost equate ourselves to the Indian tiger on the verge of extinction. Numbers are becoming fewer, right? One of the reasons is this. What you make is not very much at all. I'm not blaming anybody. I'm just giving facts as it is. Because when I started off, I said, I have no magic solutions for this. I'm just giving you this. You may start off with 8 or 15 lakhs. And I joked in another context, I said, my carpenter sometimes makes more money than that from when you join a medical college. You otherwise get into private practice, which is difficult, or you join a corporate setup, wherein sometimes ethics takes a back seat. I go back to my original question saying, is it wrong to make money? Is probably not, but probably we need to look at making money ethically, because it's the Mahatma who said, there's always enough for a man's greed. Always enough for a man's need, never enough for a man's greed. So there is some time, I suppose, you need to draw a line wherever you are and say this is enough. And like I'm a chief guest, we've been friends forever. He said very famously, he said, no doctor in Mangalore will starve. Your words. And he said, you can always take your family out for dinner, you can live comfortably and be ethical. Very, very true, that is. I draw your attention to this also, what is called the regional disparity. There's a very famous surgeon called Neelakantan Ananthakrishnan who made his name in Jipmar before he moved to this Sri Balaji Vidyapith. He's a fairly elderly surgeon now. 780 medical colleges in 2025, 1.2 lakh medical students about the annual intake. And he speaks about a phenomenon called clustering, wherein he says there are too many medical colleges too close to each other. My street is prime example. You can call it the Oxford Street of Mangalore. We have 3 medical colleges, a homeopathic college in the same street. So almost the joke is no patient can escape from there, because you get out of one medical college, you just fall into the other. So clustering sometimes is good, sometimes not very good about the government medical colleges. The bad effect of that is the same article carried, somebody called Siddharth Singh, he quotes, built to heal and left to rot. It says, nothing against the state of Telangana, but he says, unplanned expansions, not very good. No good teachers, no good hospital facilities, not enough patients. So it's ultimately a mess in that you spend so much and then you don't know what to do. And sometimes if you spend so much, ethics will probably be the last thing on your mind. If you have loans to pay, and by which time you're married and you have to pay your child's fees, sometimes life may be a little difficult, but I suppose it is possible. I move on to the second half of my talk, and that is obviously, because I'm a surgeon, this is sort of biased towards surgery, and that is ethical dilemmas in surgery. What to do, when to do, and what to do for this particular patient. All of us know this pretty woman. Everybody knows. I don't know what sir would have said if I put up this picture as a student, but then such is life. For those of us who are not familiar with this lady is Angelina Jolie, who became famous in the year 2013 when she underwent a bilateral prophylactic mastectomy. And the reason for that was she was positive for a gene called BRCA1, which is a mutated gene, otherwise it's a tumor suppressor gene, wherein the risk of you getting malignancies increases markedly. And why did she do that? Because she lost, apparently the article says, she lost her mother when she was very young, and the estimated risk was 87%. But the same article says, in small letters, it reduced the risk to less than 5%. What is not highlighted was that the risk reduced but never came down to zero, because there are certain things in this article which I wanted to share with you. It produced what is called an Angelina Jolie effect, that particular operation. A lot of good, but a few bad things. It significantly increased this awareness about this BRCA testing and genetic counseling, etc. But then, I'm sorry for that because I just cut-paste it. Many people assumed that if you have a BRCA gene mutation, you sort of were given a percentage and said, this is your risk of developing malignancy, or even further, many people were pushed into saying that if you have a BRCA1 gene, you will develop a malignancy in the breast, which is not entirely the truth. You dissect it a little further. It says there is an increased risk of developing certain malignancies, but can't tell whether the particular individual will develop or when will the malignancy develop at all. That is not highlighted. And I also said $4,000 per test. It's a little expensive. $4,000 is at current rates is much more than many of us are making. And it said the correct way to go about would be to give a sort of a better understanding to each individual at risk and tell them, look here, this is what you have, this is what you may develop. My point is, not always we tell patients everything. And in my field, it's a little more difficult sometimes because I remember Dr. Ashok Pandit joking. He said, if I tell my patients every complication of a TUR, no patient will undergo a TUR. So you sort of, there are a lot of gray areas wherein you sort of tell your patient what you want to know or what is convenient for you to help them decide about surgery, and you hope that the decision is in your favor. I'm not saying it is wrong, I'm only giving you something to chew on. There is this 4-box model, apparently, it's all theory so to say, wherein it's not only the medical indications but there are sort of patient preferences which you must take into consideration, and the contextual features. That is, an example I always quote is what you're practicing in a government hospital can never be equated to what you're practicing in a corporate hospital. So probably ethics will differ with the patient, with the place you're practicing. What is right in one place may not be right in some other places. As I wind down, I sort of must say this, what my teacher, chief guest teacher also, Professor Srinivasan said, the ability to do an operation should not be an indication for the surgery. And he very famously said, and I quote, a good surgeon is one who also knows when not to operate. Not only when to operate, but when not to operate is probably also equally important as you move on in life. There's this article which says what should be done, when should be done, when it should be done, and what should be done in this situation. It involves the consent of the surgeon, the patient, and the anesthesiologist. Though for many of us, there are no anesthesiologists around. For many of us in the medical college, consent depends mostly on the anesthesiologist, because you prepare the patient and they say, no, we can't give anesthesia, nothing you can do, because the last sentence was equally important. Surgery has a great potential for harm. You operate, and I've always said, if you put a scar on the patient is scarred for life. So there's this theoretical terms of beneficence and non-maleficence, etc., which we won't get into. A lot of theory. I wind down, I conclude by, I've often repeated this, of what I'm very fond of saying, the mother's test. There are a lot of ethical dilemmas you go through, and I've said In life, you come across many T junctions. You're going on a path, and then there is a right and a left. Sometimes it's a right, and I'm not sure, it's probably the wrong. The iffy thing, so to say. Please ask yourself, pause 30 seconds, ask yourself what your mother would think about it. Mostly, I'm not very sure that, I'm fairly certain that every mother has thought only good about her child. So if you think that the decision that you've taken goes with your mother, please go ahead and do it. 99.9, why 99.99? 100% of the time, you will be ethically correct. Thank you very much. Be patiently.
Yes. I think they introduced everything with Dr. Rajesh Badal, but they didn't say that, I forgot to say that he's blessed with a wonderful, he's married happily and he's got a great daughter. I think that part of the introduction was missed in the introduction. And he is the son of illustrious father. I had attended Dr. Rajesh Badal's father giving the SUDHAKAR Shetty Oration and Sandeep sir giving the introduction there. And I was there and I was sitting in the same chair. I was remembering that around 10 years back, I believe that. Okay. I first and also thank Dr. Sandeep Rai for being the chief guest. And as always, it's a pleasure to see Sandeep Rai in IMA Hall because I've not seen him for a few years now since he's moved out of from ANC. Also thank Dr. Rohan Shetty sir coming forward and showing his presence, showing his great respect for Dr. SUDHAKAR Shetty. Also thank my president for hosting this event. I thank for Sushant for organizing this very well. I didn't involve much. I was a little bit busy. I also thank Dr. Ulla Shetty for comparing this event. We were slightly short of MCs. We tried calling a few people. And we also short of finance when then we thought, so Ulla Shetty is there. So he happily agreed for it. And last but not least, I thank all the senior members for coming for this meeting. Slightly off a mark from the attendance, but you people have come. I would not like to take all the names. It will be a long list because there's a lot of seniors, but I do acknowledge your presence.